So today we're going to be assessing the 12 cranial nerves. Before any assessment, I'm going to want to explain to my patient what it is that we're about to do. Make sure that they understand what it is that will be expected of them, how long it's going to take. I'm going to want to provide for privacy and comfort and perform hand hygiene. So the 12 cranial nerves start with cranial nerve 1, which is the olfactory nerve. We are not going to assess that today, but you might do it by exposing them to, say, vanilla extract or lavender essential oil, scents like that, and ask them to identify the scents, see that their sense of smell is intact. So we will start with cranial nerve 2, which is the optic nerve. That would usually involve me having Sade look at a Snellen chart and asking her to read the smallest line of print of characters that she can. We would look at the corresponding value of her visual acuity, 20/20 being the standard, meaning that at 20 feet she can see what a normal patient should be able to see at 20 feet. What the optic nerve is also going to involve is testing to see that her peripheral vision is intact. So what I'm going to do is raise fingers while Sade looks straight at me, and raise fingers in her peripheral vision and ask her to tell me how many fingers I'm holding up. So Sade, look at me.
3, 4, 5, 2, 1, 5.
Very good. Moving on to cranial nerve 3, 4, and 5. Those are going to be the oculomotor, the trochlear, and the abducens. I'm sorry, 3, 4, and 6. Abducens is 6. We're going to test all those together because all three of those nerves are related to the 6 cardinal fields of gaze. So what I'm going to do is have Sade follow my pen light with her eyes, and I'm going to have her look in all 6 directions: left, up, down, and center, right, up, down, and center. And then we're also going to be looking for PERLA, which is an acronym standing for that her pupils are equal, round, reactive to light, and accommodate. So I'm going to shine my light in her eyes. I'm going to see that her pupils are round, they're equal, that they constrict when I shine my light in them. And then I'm going to shine my light in one eye while I block the other. And what I'm looking for is that when I shine my light in one eye and the pupil constricts, that the other eye's pupil also constricts despite not being exposed to light. It's best to do this in a dim setting so that you can really see those pupils constrict and dilate. And then the A in PERLA stands for accommodation. And what I'm going to do there is have her follow my pen light, and as it approaches her nose and then as she looks back and forth, we should see that her eyes move together fluidly, that there's no nystagmus, which is those small movements, and that everything is equal and symmetrical on both sides. So going back to cranial nerve 5, which is trigeminal, what I'm going to do is feel her muscles, that they're equal on her jaw on both sides, and I'm going to ask her to try to open her jaw against resistance, and she's able to do that. What I'm also going to do is test to see that the sense of touch on her face is intact. So I'm going to ask Sade to close her eyes and say yes when I touch her face.
Yes. 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 Yes.
Great. We're also going to be looking that she can discern sharp from soft sensation. So I have a cotton swab here that will produce a soft sensation, and that's what that feels like, and a sharp one that will give a sharp sensation. That's what that feels like. So I'm going to have Sade close her eyes, and I'm going to ask her to tell me when she feels something soft and when she feels something sharp.
Soft. Sharp. Sharp. Soft. Soft. Sharp.
Very good. So that's cranial nerve 6. We're going to move on to cranial nerve 7, which is the facial nerve. What I'm going to do here is ask Sade to smile real big for me, and frown, raise her eyebrows up, and puff her cheeks out. So we're looking that her facial movements are symmetrical and that she has full range on both sides. What I could also do here is test for salivary and tear duct production. So I might expose her tongue to something sour, like a sour candy, see that she salivates. We could also touch her eye, try to see that she produces tears. We won't do that for our purposes here today. So after facial, we're going to move on to vestibulocochlear, which testing for this nerve involves a hearing test for hearing acuity. So what I'm going to do is occlude one ear and whisper on the other side of her and see that she can hear the words I'm saying and repeat them back to me. And we're going to do both sides. So I'm going to say 2 words on each side. I'll start by occluding one ear.
Baseball apple.
Very good. And the other.
Football banana.
Very good. Moving on to cranial nerve 9, which is the glossopharyngeal. So what I'm going to do is ask Sade to open her mouth, stick out her tongue, and say ah. And we're looking to see that that uvula raises, the soft palate raises symmetrically on both sides. What we could also do for testing during this nerve is use a tongue depressor and check that her gag reflex is intact. So we would stick it back until you see that gag and make sure that that reflex is intact. So we'll now move on to cranial nerve 10, which is the vagus nerve. And for this nerve, we are going to test it by listening to see that her voice is not hoarse. So throughout the assessment, I'm going to be listening to make sure that her voice sounds clear. I'm also going to put my hand on her throat and ask her to swallow and see that that swallow reflex is intact. Cranial nerve 10 is the accessory nerve. What I'm going to ask Sade to do is move her head against resistance from my hand in both directions and make sure that she can do that and that it's equal on both sides, and ask her to shrug her shoulders against resistance, which she's able to do. Finally, cranial nerve 12 is going to be the the hypoglossal. And I'm going to ask Sade to stick her tongue out and to wag it back and forth. And we're looking to see that she has full range and can do that equally on both sides strongly. And that concludes the assessment of our 12 cranial nerves.